Hi everyone, welcome to McMaster and thanks for coming out to the Demystifying Medicine seminar talks. Today I'm going to be speaking to you about what research is going on for treating asthma. And although there are many different types of asthma, the research I'm going to be speaking about today deals specifically with allergy-induced asthma. So how many of you guys have asthma or someone you know has asthma? Put your hand up. Cool, so looking around you can see that asthma is an illness that affects many people. And yet there are still gaps in our knowledge today about what is asthma, how does it function, and how can we treat it. So the job of asthma researchers is to try and fill these holes in our knowledge so that ultimately everything can be directly relevant and help the patient. So what is asthma? Asthma is an illness where there's a constriction of the airways, and that makes it very difficult for the patient to breathe, particularly when trying to breathe out. For a non-asthmatic person, the inflammatory cells of the immune system, so those are the cells that cause the inflammation or the swelling, they don't really do much. They survey the body, and then when there's a virus, they'll fight it, they'll attack it, and that results in, for example, a sore throat and a cough. But for people with asthma, they have a lot more of these inflammatory cells. And the cells are hyperreactive, which means they get inflamed more easily. So what happens when these cells do get inflamed? Laser pointer. That's what we see right here. So that's where the cells become inflamed, the outer wall gets compressed, and this gooey mucus is produced right in the middle that makes it difficult to breathe. So people with asthma have this gooey mucus, and that's one of the reasons that they can have this asthma attack. What is one of the triggers for this inflammatory reaction? Well, it can be allergies, for example, to cats or to plants like ragweed, for example. So how does this allergy get developed? There is a series of reactions that takes place in your body to make you more susceptible to the allergen, so the thing that causes your allergy. And then when you inhale that allergen again, it triggers that immune response, and you get the swelling that causes the asthma. So how many of you guys have allergies to animal fur or to outdoor plants? I do. I'm allergic to ragweed. That was my example. So I bet that not all of you guys have asthma. And that's because it's not a direct 100% link. So not everybody who has asthma has allergies, and not everyone who has allergies will develop asthma. So this lets people in the asthma research field know that there must be other contributing factors. For example, environmental factors like where you live, and genetic factors like whether your parents have asthma as well. So another cause of asthma you can see on the far side there, I can use the pointer, and that is smooth muscle contraction. So unlike the muscles in your arms and legs, for example, which your brain can instruct to, say, carry this box or to support this push-up, smooth muscle cannot be controlled by your brain. So an example of smooth muscle is when you're eating and you swallow, the smooth muscle is what puts the food from your mouth down into your stomach. You don't actually have to tell it, okay, move down my body. So that's an example of smooth muscle contraction. And in people without asthma, this smooth muscle doesn't really have negative effects. But for people with asthma, actually for everybody, the smooth muscle is everywhere in your body, including in your airway. And people with asthma, this smooth muscle can contract in the airway, narrowing the airway and making it difficult to breathe. So that's another cause. So there's no easy answer as to what causes asthma. It's a combination of the inflammatory cells in the immune system and the higher amount of smooth muscle present in asthmatics. So the next question asthma researchers ask themselves is, okay, how can we solve asthma and give people with this illness a better quality of life? There's no current cure for asthma. As some of you probably know, asthma is currently managed by steroid medications in the puffer. I'm sure you've all seen that before. And so this steroid medication goes in and it reduces the swelling in the airways, and that allows the person to breathe more easily again. But that's treating the symptoms when they're already present. What if we want to stop an asthma attack from happening altogether? So there are two different therapies being developed right now. The first one is called immunotherapy, and that takes care of this part here. So that's where you take medicine that tries to stop the inflammation, tries to stop the swelling in the airway before it even happens. The second one is a more long-lasting solution, and that's called bronchial thermoplasty. That was actually developed right here at McMaster University, which is really neat. So for bronchial thermoplasty, that deals with the smooth muscle that we talked about on this side of the screen. So obviously, we can instruct the smooth muscle. That means we can't tell it when it's constricted, hey, smooth muscle, relax, take a break, I want to breathe. So the way that this procedure works is that a tube is put down into the airway, that tube is heated, and that kills off some of the smooth muscle cells, so that if they're killed off, they can't contract and cause that narrowing of the airway. So what's really neat about this therapy is that one treatment can last for 2 or 3 years, it's been shown. But a difficulty is really hard to get that tube to reach down into all of the different airways, so it's not always effective. So clearly, the fact that we don't have an absolute cure for asthma at this moment demonstrates that there's a continued need for research in this field. I hope that some of you guys will consider continuing on in your science education and becoming researchers for medicine and for asthma specifically. Thank you.